Hello and Assalamu alaikum, Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the anterior mandibular region. On the panoramic view, we can very clearly see that there is a radiolucency extending from the anterior mandibular region and extending all the way between the canine and the first premolar. So if you look at it from an axial point of view, so this is the occlusal table. As we're going to move apically, you will actually notice at this point where we have the radiolucency developing, this radiolucency slightly becomes involves cortical expansion very slightly, but right there. It does not cause root resorption at any point, and as we move inferiorly, you will see that it extends from the canine on one side all the way to the premolar on the right hand side. It's crossing the midline. Cortical expansion is very slight at this point. It is unilocular, it is empty, and it is not does not have any impacted teeth associated with it. Now this is the transaxial view or the proximal view. So it starts at the apex of the premolar right here, and then as you move further front, it extends all the way up here towards the interradicular area between the 4 and the 3 on the lower right hand side, as you can very clearly see on this image right here. There we go. And as we move further down, it becomes unilocular, is completely does not have any contents that we can observe, and there we go. So we have a differential diagnosis. It could be a a aneurysmal bone cyst, or it could be a simple bone cyst, or a solitary bone cyst. All of these are just differential diagnosis, and to get a confirmed diagnosis, a biopsy or a FNAC will be required, so that the contents can be seen under a histopathological slide, and then a confirmed diagnosis can be made. This is also a coronal view of the tooth. As you can see, at this point, we start from the anterior part of the mandible, and then we move for slightly towards the tongue or towards the posterior part, and then you can see the cyst is completely empty, and also at the same time is extending from the canine towards the premolar. Thank you very much.